diabetes, eyes, and COVID-19. Some of the common questions I get asked, one of them is, does diabetes affect eyes? Anytime I diagnose a patient and I suggest them to get their get their sugar level tested at GP, they always ask me, can you detect diabetes from eyes? And then they further ask about how can they maintain their eye health, and can eye exercises help? Some of these questions I'll try to answer through this presentation, and I hope I can help some of you in understanding how diabetes affects eyes and how we can maintain it. To understand how sugar in your blood affects the eyes, we need to understand the blood system first. So the blood, as we all know, circulates from the heart throughout the whole body. The blood vessels are thickest closer to the heart. As the blood vessels go further away from the heart, they get thinner and thinner. And the further away they are, the thinnest they are. For example, in the feet or in the kidneys where they need to exchange some fluids, and in lungs where they need to exchange oxygen, and in the eyes as well. We have very thin blood vessels in the eyes, again capillaries, and that's where most of the action takes place when we are talking about diabetic changes in the eye. So as you can see on the top, that's the capillary, and the reason they need to be thin is because they need to exchange oxygen and they need to give nutrients to the cells. And if the artery or if the capillary walls were any thicker than one cell, then it will be difficult to make that exchange. And also they need to take away the oxygen, absorb the oxygen, and take away the waste from the cells. This is the same cross-section diagram of a similar cross-section diagram of capillaries. You can see that there are some red sort of bricks you can see which are making a pipe sort of structure, and these bricks are called endothelial cells. You don't need to remember the name, and they are surrounded by a coating or a sort of cement coating, you can say, which is keeping the whole structure intact slightly, and then they are surrounded by uh, some things called pericyte. Now in diabetes these structures get affected, and the sugar inside the blood um, can damage the pericytes and affect the endothelial, um, this basement membrane, which is like a cement holding the whole structure intact, and the 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 stones or the endothelial cells which are joining together to make this pipe. When the pericytes are dead and affected, it cannot keep this structure or this brick formation intact, and they become loose, and they can start bulging outwards because of the pressure inside the blood vessel. And that bulging or ballooning, they create a balloon here, is known as microaneurysms. And these microaneurysms are one of the first signs of diabetic retinopathy or diabetic changes in the eye. And this is not hemorrhage, this is not bleeding, but when we look from the top, from an optometrist point of view, we see like a red dot. And these red dots or microaneurysms can burst and cause hemorrhages. They leak fluid as well, causing swelling in the retina, and that in return then makes the vision a bit blurry as well, and also some leakage of plasma, which we see as yellow deposits known as exudates. This is the view that an optometrist gets, and we look for these tiny signs like cotton wool spots, white spots there, microaneurysms, and flame hemorrhage. But we start off by looking at the front of the eye, and there is a small pupil which we need to look through to be able to assess the back of the eye. But pupils are generally quite small, and when you're shining the bright light, they get even smaller. And for that reason, we have to put in those horrible drops that nobody likes because they sting as well, and they take 20-30 minutes for uh, function and to fully dilate your eyes. So what are dilated pupils? So these are the normal pupils, which are normally 2 to 4 millimeters, and it is quite hard to look for the back of the eye properly with this small pupil. Therefore, we have to dilate the eyes, and it's like looking through a door, looking through a keyhole, and trying to see what's inside the room. And the dilated uh, pupils are like you open the door and you can see I have a much better look and be able to examine these small tiny details that otherwise would be very hard to see. So normal retina on the left side, as you can see, is nice and healthy and perfectly fine, whereas the diabetic retina, you can see there's obvious changes. There's hemorrhages, these yellow spots, and some swelling on the optic nerve as well. So an optometrist or an eye doctor, or the person in the van when you go for your diabetic screening, pictures taken at your GP practice, um, or at the back of a van, any health center that you go to, that's what they're trying to do. They're trying to take a picture and assess how much of a difference there is as compared to a normal retina of that particular age. And there are a lot of algorithms that can help assess the diabetic changes. And if the leakage happens, if there is diabetic changes in the back of the eye, then there are certain things that we can do to take care of it. For example, we can provide laser treatment, and we can give injections, like an ophthalmologist would do that at hospital, and we can also request the patient to maintain their sugar level, and that is ideally the best route to take, because if you have um, the diabetic changes and you get the laser treatment done at this point, it will come down to some extent, but if the sugar level is not controlled, it will continue to rise again. It will cause more damage. You have another laser treatment, it settles down momentarily, but then it goes back up again. So the idea is that you appreciate that controlling your sugar level is more important than any treatment that a doctor can provide you. So as a diabetic patient with these changes, generally the early signs or early changes don't really give you any symptoms. That's why in a lot of cases patients don't really see or notice until it's quite late. And if while being in lockdown you start seeing these black spots in your vision, which are not moving, they are constantly there, then that is something that you would need to get your advice from your local eye department, either at hospital or an optometrist. Give them a call and ask them what is the best mode of management of this problem. Just be careful that there are black spots that a lot of people notice, known as floaters. Now, the difference between floaters and these black spots is that the floaters generally lag behind a little bit. So when you move your eyes, the floater will lag behind and come to the center, and they will float around. They will be wobbling around basically. Whereas these diabetic retinopathy changes, they are constantly there. They don't lag behind, and it's because of the cell damage at the back of the eye, and they won't hover, they won't move around. In this situation, I would like you to contact your either optometrist or hospital department to take advice. Now, problems during lockdown that we have is we are always close to the fridge, and also we have lack of exercise, and our sleeping patterns are also disturbed. Sleeping pattern and our dietary patterns, they are very important, and generally they are quite ignored. Most of the patients are focusing on what to eat, but what they forget is when to eat and also their sleeping patterns. So there is a slight information about your sugar clock, but ideally how I say to my patients is whatever time you wake up and you have your breakfast, make sure that you are consistently doing that so that your body is aware at what time you're going to have breakfast, what time you're going to have your tea, and what time you're going to have your dinner. So your body um, is aware of your eating patterns, and if you stick to them, then you'll be able to cope better with it. Now, once you've got the eating pattern right or the time right, then also get the right stuff to eat. You should have a balanced diet. Avoid a lot of sugary stuff, of course, and I'm sure you always already do. Um, and lots of fruit and veg. Careful with sweet fruits. For example, these juices that these days, because of the flu virus and coronavirus, a lot of people are advising to have orange juice, or oranges are something that people are considering because of the vitamin C. Now, one of the nutritionist I was listening to, and he mentioned that one orange has certain amount of sugar and good amount of vitamin C in it. If you consume that, that's quite helpful. However, if you make an orange juice, you'll need at least 5 oranges to make the glass of orange juice. Now, the amount of sugar that you consume while you're having one orange is 5 times less than the orange juice glass that you're having, which is 5 times, i.e., 5 oranges worth of sugar you're having. And I think that's quite a lot for any person, let alone being a diabetic. So be careful on the fruits. However, basic carbs in moderation, and ideally natural rather than processed carbs, and also grilled meat if you um, like meat. And if you're tempted to eat and you want to munch on something while you're watching a movie at home, nuts are quite useful thing. I personally use almonds as well. They keep me busy, they keep me involved, and I'm not eating anything which is unhealthy. And regular exercise is very important, and regular indoor activity is quite good these days. However, the government has allowed us to go out at least for one exercise outdoor activity, either cycling or walking, whatever suits you best. But just in case the weather is not good, or you don't feel like going out, at least at home there are a lot of online channels which are working on YouTube, for example. It's quite motivational, it's quite fun as well with family. Me and my kids are enjoying that as well, and but that also keeps you fit, and a bit of fun there for you. Medications, if you've been advised by your doctor to have your medication and injections, keep up with them. Do not be slack on them, and continue with medicines and injections unless your GP advises otherwise. Um, and check your sugar levels regularly at home. That's the best thing that you can do. Even if you're pre-diabetic, borderline, or you're diabetic, it's very important to be on top of these things, because it doesn't take long before the eyes start showing damages, and some of the damage can be so severe that it is almost irreversible and can definitely lead to blindness. And best management that we can do is prevention. To check your sugar levels regularly at home using your home testing kit, and acceptable ranges for sugar levels, as you can see here, that's the graph there. As long as they're under 5, under 6 also is classed as slightly elevated. And for somebody under the age of 19, there's nice table guideline here for them. And for somebody who's over the age of 20, is guideline by WebMed I found, and I thought it's worth sharing.